Thank you. Good afternoon, and thanks again, Mr. Albritton. We welcome all of our affiliation panelists today. You'll have the opportunity to hear from some VA partners across the U.S. and Puerto Rico. I'd like to welcome our panel members. First, Dr. Willie Capers II, Assistant Dean of Student Services and Assistant Professor of Pharmacy Practice, Texas Southern University College of Pharmacy and Health Sciences. Dr. Alfreda Harper-Harrison, Associate Professor and Director of the Advanced Nurse Educator Program, Winston-Salem State University. Dr. Vilma Davis, Assistant Director and Assistant Professor, Nursing Program, Lincoln University. Dr. Olga Rodriguez, Professor of Pediatrics and Dean, Ponce Health Sciences University School of Medicine. Dr. Ezer Kang, Associate Professor of Psychology and Interim Director, Clinical Training, Howard University. And Dr. Jorge Falcon, Emergency Medicine Program Director, University of Puerto Rico School of Medicine Residency Program. Before we get started, can each panelist please share with our audience your university's partnership role with VA? Let's start with Dr. Capers.
Good afternoon. Here at Texas Southern University College of Pharmacy and Health Sciences, we're affiliated with the Michael E. DeBakey VA Medical Center here in Houston and the VA North Texas Healthcare System in Dallas.
Thank you. Dr. Harper-Harrison.
Good afternoon. My name is Dr. Alfreda Harper-Harrison. I'm with Winston-Salem State University in Winston-Salem, North Carolina. And we are affiliated with the VA Medical Centers in Winston-Salem, North Carolina, and in Salisbury, North Carolina.
Thanks so much. Dr. Davis.
Good afternoon. My name is Vilma Davis, and as was said so eloquently by you, Dr. Thompson, I am the Assistant Director of the Nursing Program at Lincoln University, and our affiliation is with the VA here in Pennsylvania.
Thank you. Dr. Rodriguez.
Hello, I'm Olga Rodriguez de Arzola. I am Dean of Medicine at Ponce Health Sciences University. Our affiliation is with the VA Caribbean Hospital in San Juan.
Thanks so much. Dr. Kang.
Dr. Kang, do you have your mute on? We are unable to hear you. Should try one more time. So it might be a setting on your end to correct the mic, but we will proceed forward and see if we can catch you in the next round.
Okay, we'll circle back. And Dr. Falcon.
Good afternoon to everyone. Thanks for the invitation. My name is Jorge Falcon. I am the Associate Dean for Graduate Medical Education, former Program Director for Emergency Medicine at the University of Puerto Rico. Thank you.
Thanks so much. So, Dr. Capers, can you tell us about the special history your facility has with VA?
Yeah, our history with the VA actually dates back to 1959 when Wilbur Harris graduated from TSU and became the first Black pharmacist at our Houston VA. Of course, since that time, our relationship has grown. And for the last 35 years, we've had an affiliation agreement where our pharmacy faculty members, they practice at the VA, they teach pharmacy students and residents, and they conduct research. But today that relationship is actually still bearing fruit for Vision 16. The two African-American chiefs of pharmacy are both TSU graduates. So I'm happy to say that Falba Adams, the chief of pharmacy for the New Orleans VA, as well as Cheryl Douglas, the chief of pharmacy for the Michael E. DeBakey VA Medical Center here in Houston, is also a TSU graduate. And Cheryl, interestingly enough, made history when she became the first African-American associate chief of pharmacy, and then of course, the chief, which she holds today.
Great. Thank you so much. Dr. Rodriguez, can you discuss the important role the San Juan VA Medical Center educational experience plays in mental health in Ponce?
Of course, I think Ponce and the VA system have had a relationship for more than 20 years. And I think that our relationship is key in terms of provision of healthcare, particularly mental health to the population of Puerto Rico, especially in what's related to veterans and to the population of Ponce in the South. Basically, the relationship is related to the establishment of a residency program in psychiatry. We did this 20 years ago. In this relationship, the residents that we began with 4 and then grew it up to 6, do their first 2 years of training in the VA hospital in San Juan, where the VA provides faculty, staff, and of course the patient population for the training of the residents. Then they come to Ponce on the last 2 years of training to participate in our mental health clinics, which basically it's a system where we are the main healthcare provider for mental health services to people that practically are under what would be the equivalent to Medicaid in the U.S. It's a Puerto Rico healthcare system. And they complete their training here, providing services to our people, which are basically from poor families, underserved families. The best of it is that our residents, most of them graduate and stay in Puerto Rico for practice. We have calculated that that'd be about around 70% of our residents that graduate from the program. The relationship has offered a great, not only health services, but basically has assured to endure that we have high quality faculty or healthcare providers in Puerto Rico. So I think this has gone on for 20 years, flawless, no issues with the relationship, and we hope it continues to go on for many, many years ahead.
That's wonderful. Thanks so much. Dr. Davis, can you share the nursing perspective with us?
Oh, certainly. In comparison with Dr. Capers, and we are like a toddler association, which our program at the Lincoln University, our nursing program started in 2014. And from the inception of our program, we have had an affiliation with the VA. And of course, in nursing, as with others, we need a place where our students can get a good clinical rotation. And the VA has really stepped up for us. And one of the things that is most significant to our department with the VA is when almost every agency hospital kind of closed their doors to us during COVID, the VA said, yes, you can come. Smaller numbers, but your students can rotate. So that was a big plus for us. And we really did appreciate it because, you know, it's difficult to have a sim lab to simulate a person who is having psychotic or mental issues that need intervention. So that was very very thankful. And when we look at our students with their evaluation, they really do love the diversity of exposure there, the various cases that they are able to learn from. So going forward, I am hoping that this will continue to be a partnership where we can always rely on the VA to have our students get their so needed experience. And we are really grateful for that.
That really sounds fantastic. Thank you so much, Dr. Davis. Dr. Kang, let's see. Are we doing a little bit better with the audio?
Everyone hear me?
Yeah, there we go.
Oh.
Why don't you begin by sharing with why don't you begin by sharing with the audience your university's partnership with VA?
Sure, I'll be happy to. Good afternoon, everyone. My name is Ezer Kang, and I am Associate Professor of Psychology at Howard University. I'm one of the core faculties in our Clinical Psychology PhD program. Our main local affiliation is with the Washington, D.C. VA Center.
Great. And would you be able to share with us the value-added relationship Howard University has with the VA, as well as the transition to full-time VA employment post-training?
Right. Well, VA training at the externship, practicum, and also internship level for clinical psychology students in our program has been a much coveted program. I think primarily is because it aligns with our core mission, which is to integrate clinical science and practice to address disparities in health outcomes and also healthcare access. Bearing that in mind, the VA does offer very unique opportunities to kind of address those core needs. On a personal note, I trained at the VA Ambulatory Care Center in LA. And I think I wanted to raise that because I think it's very illustrative of the training opportunities that VA Centers offers in terms of working with populations that are historically underserved. At the VA Ambulatory Care Center, we work primarily with VAs with unstable housing, since given our proximity to Skid Row in downtown LA, and also with people living with HIV. It was my first exposure to doing group work with folks that were living with the virus. So that kind of gives you a snapshot of the diverse range of communities that our trainees have an opportunity to work with. The other strength of VA training for our students is the availability of supervision for evidence-based treatment, both at individual and group modalities, but specifically situated in a primary care setting. And that's very important because of the trend towards behavioral health. Many of our students would want more experience working in a behavioral health setting. And also lastly, which is a little more specific to our training at Howard, we're one of two PhD programs that's accredited by the American Psychological Association among all HBCUs. So we have a lot of students that are very interested in having more specialized training in neuropsychological assessment. And the VAs, both locally as well as nationally, do have a reputation of a very well-touted reputation of offering specific training in neuropsych assessment that's coupled with neurocognitive rehabilitation treatment. I just want to add that for the past 10 years, PhD students in the clinical psychology program at Howard, about 20% have trained at VA centers across the country at the externship as well as at the internship level, and that clearly leaves open opportunities for more postdoctoral fellowships and research opportunities.
That's really fantastic. I love to hear the cycle of training and then going out into the community. That's really wonderful. Thank you. Dr. Harper-Harrison, thank you for joining the panel. Would you discuss and emphasize the interprofessional experience gained by your trainees?
Absolutely, thank you. Our university is uniquely located such that we have the opportunity to spread our students across 2 VA facilities. And our program has the traditional baccalaureate and our RN to BSN students, as well as our master's level nurse educator, family nurse practitioner, and doctoral students that they use these facilities to complete their practicum, clinical, and residency experiences. The VA offers such a unique experience to our students because they expose them to a variety of clients with complex medical concerns, often very different from those that they would experience when in a traditional hospital experience. These experiences also allow our students to observe and practice skills so that they can become proficient in them. One experience our traditional students, especially those completing their mental health rotations, is the physician's rounds that they get a chance to participate in. they get an opportunity to see the provider and the client dynamics, and then how the provider himself is able to interact with the care team to manage those concerns of the client. In addition, our nurse practitioner students work with a preceptor, of course, and they have an opportunity to actually care for these clients with these complex medical concerns. And that offers them the opportunity to hone their assessment skills and their diagnostic skills. And that is very essential to the growth and development of a new practitioner. Our nurse educator students have a greater access to clients, enabling them to develop and provide teaching materials to the clients to help them understand their diagnosis, importance of following those treatment regimens, and how to perform essential skills such as wound care, finger sticks, and understanding their blood pressure readings, which is important to help maintain the client's health status. And because the hospital and clinics are set up so that they incorporate these interdisciplinary care circles to help care for the clients, the students are exposed to these multiple opportunities that they get a chance to interact with various departments, and that helps them to develop and foster their positive interprofessional relationships. The care team experience and the care team meetings that they have at the VA offers a great example of the unique experiences that our students get when they're conducting these clinicals at the VA. And at the end of the semester, our students, they provide these evaluations of the facilities. And what we get most is that they've learned so much, and that they've had an opportunity to practice their skills, and that they enjoyed the experience overall. And thank you so much for this opportunity to share just a snippet of how the relationship between the VA and our facility has been beneficial to the development of our next generation of nursing leaders.
Thank you so much. I'm always so impressed at the opportunities available in the VA for interprofessional education. And it sounds like your trainees have really had a wonderful time, wonderful educational experience. That's just great. Dr. Falcon, welcome all the way from Puerto Rico. Glad to have you today. What has been your experience working with VA?
Dr. Falcon, you're on mute.
It's on mute. Now I'm mute. Well, the University of Puerto Rico has an academic association with the VA Caribbean healthcare system for more than 40 years. The hospital has been one of our most important clinical sites, where our residents are trained in emergency medicine, critical care, general surgery, anesthesia, urology, geriatrics, internal medicine, and family medicine, among others. VA Caribbean healthcare system is working in a series of projects to increase the workforce pipeline. And this, of course, include our residents and fellows. So after they end their residency programs, most of them decide to stay in the hospital as faculty, and even having opportunities in the as leaders in the hospital. Among these projects, to increase the workforce pipeline, they have been updating their VA website, and this allow also our residents and healthcare related programs to know the training opportunities and attract more workforce also. So they also have been working in a national pilot to promote and develop a high reliability organization culture. And that's very important because it includes employee engagement, leadership involvement, and psychological safety. So these three pillars promote a clinical environment where our residents and fellows can raise their hands and have a say, bring their perspective and diversity. And this is very important for our residents and for the accreditation agencies also, which are very important on these days. They also have diversity collaborative programs, and that's very important also. So all these efforts have contributed for many of our residents having decided to do fellowship programs at the institution, at the VA hospital, become part of the medical facility, of the medical faculty, and even have leadership positions in our institution. So we appreciate the academic association that we have been having with the VA Caribbean healthcare system for the last almost more than 40 years. In addition to educating them, they also gave them the opportunity to be part and employees of the hospital after they finish their training. So we are very happy with this. Thank you.
Thank you so much. It just sounds like a wealth of opportunity and such a pipeline to post-training experience and opportunity as well. So that sounds wonderful. So if any of you could expand your current affiliation partnership with VA, what would that look like? Maybe Dr. Capers, what would that look like from your perspective? How would you expand your affiliation?
Good question. I would love to see like the Valor program, for instance, be something that I would love to see return. That program was an extremely successful pathway for our pharmacy students to match for residency programs as well as secure pharmacy positions. Speaking of residency programs, expanding partnerships with colleges of pharmacy or just VA funded type pharmacy resident positions would be wonderful. Lastly, I would say that we also have about 6 undergraduate health science programs. So it would be great to expand internship opportunities for those students.
Absolutely. What about you, Dr. Rodriguez? If you could expand your affiliation with VA, if you could get your wish have your wish come true, what would it look like?
Yeah, I will start answering that question talking about the challenges that Puerto Rico has related to workforce. So right now we have a lot of faculty members that are leaving the island to go to the mainland for greater opportunities. So as a medical educator and as a dean and as a peer of the other deans of the other 3 medical schools in Puerto Rico, we desperately need more residency programs in Puerto Rico. When you look at the data, you find that 75% of the physicians that train in the island stay for practice in the island. So my dream would be to have the VA hospital in San Juan to increase the number of residency programs that they offer, and to expand in a manner like we did with the psychiatry residency program, so what we can do those kinds of dual relationship, so that they can help us a lot with the mostly one of the greatest challenge that we have is paying the residency slots. So if we somehow can share that, we would be successful training more physicians in Puerto Rico. I also want to mention that the VA system in Puerto Rico also has clinics outside the VA hospital in San Juan. There's one in Ponce, there's another one in Maya West. I use them a lot for the training of our medical students. So I wish that those relationships could be strengthened so that I could send more medical students for clinical rotations and experiences in the clinics. But again, I would say expanding graduate medical education using the VA system as one of our major partners in that, for that to occur, that would be a dream come true for me.
Wonderful.
It would definitely benefit Puerto Rico in general.
Absolutely. Absolutely. Thank you. And thank you all for joining us on this very important panel today. Before we turn it over back over to Mr. Albritton, I want to encourage our audience members who are interested in partnering with VA to reach out via the group email or via the OAA intranet page. We will be posting at the end of the summit for additional information. Mr. Albritton, I will turn it back over to you, and thanks so much.